So for preparation, I'll stay standing on the client's right side. And then the order that I'll go for the assessment would be inspection, auscultation, percussion, light palpation, moderate palpation, and then deep palpation. For clients that have a chief complaint of pain, I would percuss and palpate that section last, and I would palpate and percuss lightly or as tolerated to prevent guarding of that section. So for inspection, we're gonna look at about 3 different signs. The first sign that I would notice, if I see a colon sign, that would be ecchymosis or bruising around the umbilical area. And that can mean acute pancreatitis or the abruption of an ectopic pregnancy. The next sign would be the Gray-Turner sign. That is ecchymosis or bruising in the flank area, which she doesn't have any. That also can be acute pancreatitis, or it could be a sign of retroperitoneal bleeding. Next, I will look for distension of the abdomen. That I would name I am going to name 5 of the signs that I can look for, 5 of the 9 that they listed, which could be a fetus, fat, fluid, flatulence, or a fatal tumor. So that was inspection. Next, I'm going to auscultate. So I'm going to auscultate the 4 different regions with the diaphragm of my stethoscope. Okay, so bowel sounds are present. The absence of bowel sounds could mean that there's an ileus, or it could mean that there's peritonitis. Hyperactive bowel sounds can mean that someone's having a GI bleed or gastroenteritis. And then high-pitched sounds can mean that there may be an obstruction in the abdomen. So next, I'm gonna look for an aortic aneurysm. So I'm gonna start by listening to the aortic with the bell of the stethoscope, the aortic artery. Okay, I don't hear any bruise or any abnormal sounds in the aorta vessel. And then next, I'm going to palpate with both hands. I'm gonna set this down for a second. The aorta region. And you know it's abnormal and it's a sign of an aortic aneurysm if you feel a pulsatile mass, or if the diameter is greater than 3 centimeters, in which neither was present. So that was the assessment for the aortic aneurysm. Next, we're gonna move on and do liver examinations. So first, I'm gonna start by doing the percussion test. So what I'm gonna do is I'm gonna percuss and I'm gonna mark. I mark once I start feeling the dullness, and I go upward, and then when I keep going the opposite way, when the dullness goes away, I mark again, and that should be about 6 to 12 centimeters. Okay. I'm gonna start from the bottom. I'm gonna set this down right here. felt it about right here. And I'll mark the top. So I got about 6 centimeters for that one. And the next test is called the scratch test. So with this one, I would do the similar motion, but instead I would have the diaphragm of my stethoscope on her xiphoid process. I would scratch upwards until I hear a loud sound, and then I would mark. Then once I hear the sound fade, I would mark again, and that should be the liver, and that one should be at about 10 centimeters. Okay. And my markings for that was about 10 centimeters. The next test that I'm going to do for the liver is deep palpation. So I'm going to palpate the liver. And if you could take a deep breath for me. Okay, and when palpating the liver, if you happen to feel more than the edge of the liver, hardness, or any irregularities, those could be negative signs that the liver may be enlarged or that it needs further assessment. Next, I'm going to do the fluid wave test. So I'm just gonna have you have one hand on your stomach, okay? So I'm gonna palpate one side, and I'm gonna tap on the opposite side, and I'm gonna do the opposite side. Okay, so if a fluid shift is felt from one side to the other side, that means the person may have ascites. That is the fluid wave test. Next, I'm going to assess the gallbladder. We're gonna do this with the Murphy sign. So with that, I'm gonna palpate the gallbladder. If you could take a deep breath for me. Okay, you would know that there may be an issue with the gallbladder if when the person is inhaling, they abruptly have to stop due to the pain. But she did not, did you experience any pain when I was palpating your gallbladder?
No.
Okay, so if the client is experiencing pain and it has abruptly stops to guard the area, that may be a sign that there may be something abnormal with the gallbladder. Next, we are going to assess the spleen. The spleen is located in the left mid-axillary area, particularly around the last intercostal space of the lung area. So I'm gonna start, can you lift your arm up, please?
Mm-hmm.
So I'm gonna locate that area, and I'm going to first percuss. And can you inhale for me? I'm gonna percuss again. Okay, so a normal finding would be a resonance felt over the lung area. If when I percuss and I feel dullness in that last intercostal space or below it, if I feel dullness instead of resonance, that may be because the lung is pushing the spleen under my finger, and that is an abnormal finding. Okay, and if you can turn on your right side for me, please. I'm gonna do a deep palpation. can lift your arm up. And do you feel any tenderness?
No.
Okay. And can you inhale for me? Do you feel any tenderness?
No.
Okay. If tenderness is felt, hardness, or any rigidity, or also if I feel more than the edge of the spleen, that can be an abnormal finding that the spleen may be enlarged. Okay. All right, if you could turn back on your back for me. So now that we've done the spleen, I'm gonna do a few tests that we do to test for appendicitis. So the first one is the McBurney's test. So what I would do is mark about 2/3 from the umbilicus to the anterior superior iliac spine and locate the McBurney's point. And I will palpate. Do you feel any tenderness or rigidity?
No.
Okay. If pain or tenderness is felt, that may mean the client has appendicitis. So the next test is the Ronsing's test. So with that one, it's a referred pain test. So with this one, I'm going to palpate on the left lower quadrant, and then if pain is felt on the right lower quadrant, that may indicate the client has appendicitis if they feel pain when I press. Okay. Do you feel any pain on your right side when I press?
No.
Okay. So she didn't feel any pain when I pressed down. The next time is going to be a rebound tenderness test. And this also is another referred pain test. Okay. Do you feel any pain when I lift?
No.
On your right side?
No.
Okay. With the rebound tenderness test, if she felt pain when lifting, that could be a sign of appendicitis. Okay, so the next test I'm going to do is called the SOS test. If you could try to lift up your right leg, and I'm gonna put resistance against your leg.
Okay.
And as I'm pressing your leg, are you feeling any right lower quadrant pain?
No.
Okay. Alrighty. The next test after that is the arbitrator test. So what I'm going to do is internally rotate her hip by pushing her knee inward and bringing her ankle towards me. Are you feeling any pain in your right lower quadrant on the right side?
No.
Okay. All right, so those are the tests for appendicitis or inflammation in that area. The last test that I'm going to do is to check for kidney tenderness. And the way that we do this is by percussing the vertebral angle. Okay. So if you could stand up for me, please.
Oh.
So what I'm going to do is palpate the costovertebral angle. I don't know if you can see it. The costovertebral angle. Sorry, I don't think it's good. Okay, so I'm gonna percuss. And did you feel any tenderness when I was percussing?
No, I didn't.
Okay, if any tenderness or pain is felt in that area, that can be indicative of pyelonephritis. And that is the examination. Thank you.